Benign prostatic enlargement, where there's no cancer, is a very, very active field worldwide. It's the commonest condition that affects men. Can you believe it? The commonest condition that affects men. Everybody, as we get older, we say it's aging. We have to go to the toilet at night time. We have to stand there at dribbles. We sort of compete against our grandchildren. You know, we're really getting older and it's really tough. And, you know, it really is just getting older. But having said that, at times the symptoms of an enlarged prostate get so severe that you need to treat it. And this field is evolving faster than even prostate cancer treatment is evolving. So what can we do if our symptoms of enlarged prostate get really symptomatic and bothersome? Well, the first thing is to find out whether it's the prostate causing them. Or is it because you've got sleep apnea? Or is it because you're drinking too much water at night? Or is it because you're drinking alcohol at night time? You know, you really need to work out what's really causing the problem. And sometimes charts of intake and output and flow tests and ultrasounds will help you work that out. But once you're sure that the prostate's the problem, then your first step is to do something simple. Have a simple herbal treatment, something like saw palmetto off the shelf in a chemist, to see if that helps. It's simple, it does no harm, and it's the least invasive treatment for the very beginnings of urinary symptoms. Another option for you with benign prostatic enlargement is to take medications. And one of those medications are alpha blockers, and the other one is alpha reductase inhibitors, sometimes in combination. And they are generally used before any surgical intervention. The next group of treatments are what we call minimally invasive treatments for an enlarged prostate. Now, the traditional, what we call gold standard, is a rebore or a transurethral resection of the prostate. Now, the problem with that is you're in hospital for 2 days, you've got bleeding on and off for a few weeks, you have a dry ejaculate forever after that, things can go wrong. So there's been a movement worldwide of developing technologies which can be minimally invasive to help with your urinary symptoms but cause minimal side effects. The common ones are Urolift and Resume. Now, Urolift puts little strings in that open up the prostate to improve the flow, and whilst it's not quite as durable as the gold standard TURP, it certainly protects you from getting a dry ejaculate and will give you 5 or 10 years, maybe more, in terms of improvement in urinary symptoms. It's a good option. The next option is Resume, which is injecting steam into the prostate. Why would we inject steam into the prostate? Well, because the steam's hot, kills the tissue, tissue dies, scar tissue occurs, and the prostatic cavity that the urine passes through gets bigger, and it improves your flow. It's not such a simple treatment, and whilst it was originally thought to be a perfect treatment because it was so simple and easy to administer, people have a catheter in for 6 days, it takes 6 weeks to get good, only 90% get a good result, and a small percentage get a dry ejaculate. So it's not perfect, but it's certainly very minimally invasive, and used in the right patient, it's a really good option. The next one is a thing called iTind. Now, iTind I have very little experience with myself, and I found that it caused a lot of discomfort in the early days, and so I've steered more towards the Urolift or the Resume procedure for my patients. I'm sure there are other people who like the iTind, but it's not been something that I've embraced. So the final option, of course, is when you've got really severe symptoms and you really want the end of this difficulty passing urine, you're standing at night time for 5, 10, 15 minutes to wait for the urinary flow to get out, you don't empty your bladder. At that stage, you're better to go with the gold standard. Now, the gold standard is called a transurethral resection of the prostate, where you shave a channel, a bit like plumbing, through the prostate to make a bigger channel. Now, that's a great option, but it does need experience and it does need care. Another option achieving the same cavity is called a holmium YAG laser. Now, that's just using a different piece of energy source to get the same outcome. And you do it by getting rid of that same piece of tissue. And there's a lot of marketing that goes on between these different technologies. But ultimately, if you look at the trials, the two are very comparable. But both need experienced clinicians. There are a whole bunch of new technologies coming in. I could tell you another 10 new treatments which are on the horizon. Don't be the first to have a new treatment. Rather have the established minimally invasive treatments like Resume or Urolift, or a standard treatment like a TURP or a HOLEP. Now, there is one other treatment which I think you should be aware of, and that's called prostatic arterial embolization. What that is you get an interventional radiologist, a bit like a person who does an angiogram, to actually block the blood supply of the prostate by embolizing it. Sounds stupid, but it actually works in 70% of patients. And it's minimally invasive, great for patients who are on blood thinners or have massively enlarged prostates. And because it's so minimally invasive, it can actually lead to a great outcome without any real major side effects. Something worth considering. And then the final thing is when the prostate is so big, maybe greater than 200 cubic centimeters in size, sometimes you have to revert to removing that big enlarged prostate in part. And this used to be done by a cut, but these days it's done by robotic simple prostatectomy. The beauty of that compared to having a 4 or 5 hour TUR or HOLEP is that it causes less damage to the urethra and ends up giving you a great result. The disadvantage, of course, is it's more invasive. But for the very enlarged prostates, it's certainly something to consider. So the options for benign prostate enlargement are becoming much more complex, and you really need to sit down with your urologist who offers these treatments and understand what's your priorities. Is it a retrograde ejaculation avoidance? Is it just improve the urinary symptoms? Is it simple reassurance? What is it that you want? And then work out what treatment works for you.